right, Clean Freaks, welcome to episode 1 with our water quality expert, Jeffrey Paquet, the CEO of VERDA Water Quality Systems. Jeffrey, you're not a new name in face around Beyond Clean. You've been our water quality expert here for a while, but that's all been written content. And we're finally getting you in studio for these new video expert series to get to share the passion, get to see the passion in your face as you're dropping these knowledge firebombs on us on the topics of water. So welcome to the studio.
Thank you very much, Hank. Glad to be here.
So, there's a hot topic. I think this is one of the hottest topics in the sterile processing industry today. And obviously it has implications even outside of sterile processing within the healthcare facility. And those implications impact people. So we wanted to start episode 1 talking about these teams, these multidisciplinary teams that need to be involved in anything when you're talking about tweaking, addressing, monitoring, impacting your water in a positive fashion. And so let's just start and say, who are these teams? Who are the people that need to be involved when you're confronting water quality in your SPD?
Right. So as you know, the ANSI standard for SG 108 was released back in August of 2023. And we've just seen an explosion of people becoming interested in it now. There seems to be a lot of people who this is on now, definitely on their radar. And so, one of the first steps that are spelled out as a requirement in the AMI document is to have the multidisciplinary team. This should sound very familiar to hospitals because for a number of years now, they've been responsible for managing the hospital water quality throughout the facility, mainly targeting Legionella and other diseases that can be borne by water or aerosolized and borne by water. And so some of the same types of people that are on that multidisciplinary team would be on this one. And so heading up the team needs to be senior management, and that's somebody who can actually make decisions that can allocate resources like money and people's times and prioritize things. You definitely want to have facilities on the team. They know the most about where the water is coming from, what's happening with the water, its quality, what the different control points are in the hospital, what's being done. Obviously, infection prevention. They're sort of the QMS representative for the team. They're knowledgeable about compliance and policy and those type of things. And then you want to have, obviously, somebody from the sterile processing department that knows about device processing, about how water is used, what the points of use are, what types of issues they may be having with water quality. Then there's clinical engineering, who are involved with the risk management in the care of patients, along with planning for equipment and purchasing equipment and all things patient safety. And then you have your surgical suite personnel, who definitely are a downstream customer. It's important to have the customer involved on the team. That's going to be a very effective add to the team. And, they're really the voice of the customer. These are the people you're delivering things to, and they are going to see the problems or the perceived problems that are coming, that could be coming from water in your instruments. Then also having some outside help. One of the things that we recognized earlier as we began to develop a specialty in water and managing water is that there just isn't enough expertise in the hospital, because although the facilities people are often very knowledgeable about water, they're not knowledgeable about everything water. And so having an outside water treatment specialist or water quality specialist is certainly appropriate for the team.
It's interesting to get that background, even as a sterile processing clinician myself. I don't know if I was aware that my facility already had some kind of water quality team together, or should have had something like that. But then especially now, as you said, with the new guidelines coming out in our space and in our world, now we're looking around and saying, okay, if that team already exists, how do I find out about it? How do I make sure that I insert myself as a sterile processing clinician, but then also, as you mentioned, even from the customer side in the operating room, how do we make sure that we align that existing group and then get all of us together at the table at one time?
Yes. Yeah. Very important to do that. And the key is, just being focused on the customer, which ultimately is the patient, and having all those people available that are involved in the value chain of supplying healthcare on the team.
So when we talk about multidisciplinary teams, when we talk about collaboration, it's usually good. It sounds like sunshine. Everyone's coming together. We're singing Kumbaya. But at the same time, when you get all these different stakeholders at the table, there can be differences of opinions. There can be friction that comes up. What are those common areas that tend to challenge the vision for this multidisciplinary group to keep the main goal in mind, which is get us from point A to point B, which is better water?
Right. I think the biggest thing is getting buy-in from groups beyond sterile processing. Obviously this is important for sterile processing, but the understanding of why it is also their job as well can be a bit tough. Now, we recently went to HSBA, and there was a talk about this sort of thing where where they had a gentleman speak from a facilities perspective about water. And they said, quite frankly, facilities, their position, that is, if they're not required to do it, if it's not a regulation, which ANSI SD 108 is not regulatory, if we're not required to do it, we're not going to do it. We do not have the time, the resources, or whatever to do that. So there's an immediate roadback with facilities, and it's not that they don't want to help you out, but like everybody else, they're in a big crunch with resources and personnel, and it's like, and the ANSI SD 108 standard is extremely dense, and it's often more complicated than what they have to manage in the facility for many reasons. And to bring this on, they're like, kind of, no way, we're not doing this. So that this could be an issue, I think. And then, everybody who is a customer of the instruments, it's like, why do we want to solve your problem? And this is your problem. We have our own problems to solve. We don't have to solve your problem. But I think what everybody has to get into the mentality is that everybody's job is going to be easier if you all invest in it. And I think it's very important for SPD to lobby for buy-in from other groups, because when there is a problem, a lot of times it can't be solved by SPD alone. It's just their problem. So.
Well, Jeff, that's a terrific intro into what I know is going to be a fascinating next 12 or I guess 11 interviews in this series on water quality. And we're going to come back with episode 2, talking about setting your program goals for water quality. And we're going to bring in this multidisciplinary vision. We're going to talk about moving this ball forward in the context of all the challenges that we just laid out. Okay, but then still, how do we get from point A to point B? So if you're not already subscribed to our channels, make sure to like and follow the page. That way you don't miss the next episode where we bring Jeff right back here to talk more about water quality. And until we talk to you again next month, as we remind you all the time here at Beyond Clean, keep fighting dirty.